My name is Shelby Taylor.
And I'm Emani Hood, and we're going to begin with palpations. So the first palpation that I'm going to do is the great toe. I'm going to have the patient sit long seated. Okay. And I'm going to find the first metatarsal, which is the great toe. I'm going to palpate it. The next thing I'm going to palpate is the tendon of the extensor hallucis longus. I'm going to have the patient flex their foot. And I'm going to feel around the middle of the first and the second phalange or metatarsals. And there's going to be a rolling pencil-shaped structure that I can feel with my finger.
Okay. I will be showing how to palpate the calcaneus. So I will also instruct my patient to sit long seated. And then I will find the calcaneus, which is located at the bottom of the foot, or as some would call your heel. And I would palpate all around that. I'm palpating with my fingers, not my thumb, so that's why I'm holding it like this. We got that. And then next, I will palpate the posterior talofibular ligament, so that I'll have the patient go more inverted just so I can get to the side of the foot better. So I will find the lateral malleolus, because I know that's where my fibula is going to be, and then my tal is going to be right behind that, more posterior. And then right in that little divot, it's about a finger shape, right in there. I'll be able to palpate in that right there. Next, we'll be doing our manual muscle testing. So I'll be doing the anterior tibialis. So I'm going to make sure that my patient is sitting short seated. I'll go up to where, I'll have them flex their foot for me and dorsiflexion. And what I'm going to do is push down to making them, almost forcing them into plantar flexion, but I will instruct my patient to not let me do that, and I'll grade them that way, 0 being they can't even get here, which we can, so we know she's starting at a 3. And then I'll do a lighter pressure. She gets that, great, we know she's at a 4, and then I'll apply more, I know she's at a 5. So don't let me push you down. Okay, we're gonna do that again. Awesome, so she is at a 5.
I will be doing the manual muscle test of the flexor hallucis longus. So I'm going to instruct my patient to sit long seated so that I can easily reach her toes. Okay, so I'm going to instruct my patient to flex her big toe, and I'm going to pull to bring her big toe extended, and she's not going to let me pull it back. She's then going to be graded from 0 to 5. We know she can flex her big toe, so she's starting at a 3. Put a little pressure. Good. And I'm going to put a little more pressure. And she's a 5. So now we will be stretching and strengthening the muscles. So the muscle I'm going to be instructing Shelby on is the soleus. So what Shelby's going to do first, she's going to stretch her soleus. What she's going to do first is she's going to stagger her feet. She's then going to bend her knees to disengage her gastroc. She's going to put her hands flat on the wall, and she's going to push into the wall while continuing to bend her knee to engage her soleus. She's going to hold this stretch for 30 seconds to a minute. To strengthen her soleus, Shelby will bend her knees again, flex at the knee. She will then begin doing heel raises, and this is again going to disengage her gastroc and engage her soleus. That was a body weight strengthening. To strengthen using equipment, I'll have Shelby take a seat. After Shelby takes a seat, she's going to take this big book and place on her lap. She's going to make sure to keep her knees bent and her feet flat on the floor in the beginning of the exercise. Once Shelby begins the exercise, she will begin doing heel raises with the book placed on her lap, and these are heel raises with equipped.
So next we will be doing stretching and strengthening of the extensor digitorum longus. I will have my patient, we'll stretch it first. I'll have my patient sit long seated on the table. And we'll do equipment first. So I have this light TheraBand, something that's nothing too crazy, you know. So since we're trying to strengthen the extensor, we want to put it on the inside of her foot, and I will be holding, as the practitioner, I will be holding to where I'm pulling her into plantar flexion, getting a good grip on her shin, just so it doesn't roll around and she's only doing dorsiflexion and not internal or external rotation. And she will then begin to dorsiflex her foot against the resistance. So that is with equipment. And then without equipment, you can stand up for me. For this one, you will start on the far end of the wall. And again, we want to engage that extensor, so we are going to then flex up our feet. We're going to be doing heel walk, so she will end up walking back and forth on her heels however many times necessary. That is great, good job. So that will be for body weight if you don't have any equipment. Next, to stretch it, I will have her sit, we'll do on the floor. So you can come sit on the floor right here. Oh, my fault. We're gonna sit on our knees and our shin. And you can face the wall just so we can see the side of your foot. So now that we have her feet in extension, this is already a good stretch, but to do even more for the extensor digitorum, we will grab the back of our toes, not the back of them. And you're gonna stay, and you're just pulling up your toes as you sit down. So then it stretches that out. It's almost like a little extra bit of a stretch. And that is it for stretching and strengthening the extensor digitorum longus. Now we'll be doing our range of motion. So we'll be doing plantar flexion. I'll have my patient have her foot in neutral. I'll find her lateral medialis, and that is where I will put the fulcrum right there. I will keep the stationary arm in line with her fibula, keeping a nice grip on it so it doesn't move, and lining up the movement arm with her fifth metatarsal. Let's see. We're at 15 degrees, and then I will have her plantar flex going in line with her fifth metatarsal as well. And we are at 50 degrees, which would be a 35 degrees range of motion, which is slightly under the typical, which would be 40 to 50.
Now we will be evaluating range of motion for inversion. So the first thing I'm going to do is have my patient put her foot in neutral position. I'm then going to line the stationary arm of the goniometer up with her tibia. I'm going to put the fulcrum midway between her medial and lateral malleolus, and I'm then going to line the movement arm up with the base of her second metatarsal. Her starting point is 7 degrees. So I'm going to place the goniometer back there, stabilize the stationary arm with my hand, and ask my patient to invert. After inverting, it measures between 29 and 30 degrees, which means that her inversion is between 22 and 23 degrees, which is typical.